And well, there is a treatment for COVID-19 that's been around since November 2020, according to Tennessee Health Commissioner Dr. Lisa Piercy, but you may not have heard about it. It's called monoclonal antibody treatment. 6 on your side's Kristen Gallant shares how it's becoming more readily available here in East Tennessee. Kristen?
Bo, the treatment has been used in hospitals for patients who have become critically ill with COVID-19 and who are at high risk. Now, primary care groups are able to give the treatment to high-risk patients as soon as they test positive for the virus. Doctors in East Tennessee are starting to see COVID-19 cases rise once again.
1 in 5 of the people we test now are positive for COVID. So unfortunately, we're seeing a lot of cases in East Tennessee. We're seeing anywhere from 40 to 50 positive cases per day.
As cases increase, the Food and Drug Administration has approved a new treatment for mild to moderate COVID-19 patients at high risk of progression to severe disease.
It has just become available in primary care. We've had monoclonal antibody treatments for the very high-risk patients since about December, but they were only happening in the hospital infusion centers for the older patients and those with higher risk.
Summit Medical Group is jumping on board with the hopes to keep COVID patients out of the hospital.
The majority of patients in Tennessee who are found to have COVID are actually eligible to receive the monoclonal antibodies. The research shows that the actual symptoms are reduced by about 300%.
Tennessee Health Commissioner Dr. Lisa Piercy says they're starting to distribute the treatment to multiple primary care facilities across the state.
In a pharmaceutical laboratory, you can manufacture antibodies that will fight COVID infection just like your own body would. This is a medication, some people call it a therapeutic, that you can take to prevent the progression of your disease.
The treatment can be given through an IV or a series of shots.
And there are plenty of people who are positive with COVID that honestly didn't know that this is even an opportunity.
Though doctors continue to say the best way to prevent getting COVID-19 is by getting the vaccine, this new treatment is a turning point in helping to fight off the virus for those who test positive. Now, Summit Medical Group is giving the treatment at about 50 of their sites, including their express clinics for those who are not patients or members of the Summit Medical Group. There's a zero out-of-pocket expense for patients who have Medicare.